Hello, everyone. This is Nicole Jorwic, the Senior Director of Public Policy for the ARC of the United States. I'm glad to be joining you to give an update on what's going on in the face of the COVID-19 pandemic for people with disabilities. The third COVID-19 package was signed into law on March 27th. Congress is now home in their districts and states until April 20th, unless they are called back sooner. Along with the asks that I will be sharing, I encourage everyone to remind your representatives and senators that the needs of the community must be addressed, that it is their role to lead and encourage them to get back to DC sooner to pass legislation that impacts the disability community. The disability community includes millions of individuals with underlying or pre-existing conditions, their families, and the direct care workers who support them. People with disabilities are and will be particularly at risk for COVID-19 as it continues to spread across the country, facing high risks of complications and death if exposed to the outbreak and needing to isolate themselves for protection. The strain on the Medicaid system and the direct support professionals and service providers that are providing these services are great. Today, I will highlight a handful of positive aspects of the first packages and give you tools for assessing funding, accessing and assessing funding that were part of those packages, and discuss our highest priority asks for package 4. First, in package 2, it's important to note that there was a 6.2% federal match or FMAP bump, which will put more federal dollars into state budgets. It is important that advocates on the ground are reaching out to governor's offices and state Medicaid offices, asking for some of those additional funds to go to the important needs of the direct support workforce and the disability community. When it comes to package 3, there were some good pieces. One, it included nonprofit organizations that receive Medicaid funds in the small business loan programs. This will allow service providers to access funds to continue operations as we work to get additional funds to provide necessary home and community-based or HCBS services and funding for the workforce. The tax credits to cover the cost of paying for paid sick days and expanded FMLA were made refundable. The IRS will be issuing forms and guidance for businesses to use. It did include new stimulus payments for low-income individuals. However, unfortunately, people with SSI or Social Security will have to have filed 2018 taxes or will need to file 2019 taxes in order to receive this payment. That will be a problem for a lot of people with disabilities on SSI. On the plus side, those payments are not counted as income and not counted as assets for 12 months, which was one of our asks. We will be getting more information out to folks about how to file taxes, and we will also be looking for further fixes around that provision in the next package. The bill, package 3, also included a mandated access to 3-month supply of medication for people on Medicare who need to isolate because of their pre-existing condition. However, it did not include controlled substances such as some seizure medications, and it also did not include coverage for the 3 months for the payers of Medicaid and private insurance. It was only for Medicare. The third package also included additional education funds that can be used for various education programs, including the Individuals with Disabilities Education Act or the IDEA. It also included funding for HUD programs, including $4 billion for emergency solution grants for homelessness assistance, $5 billion in community development block grants, $1.25 billion for housing choice voucher programs, $1 billion for project-based rental assistance, and $15 million for Section 811 housing for people with disabilities. The housing wins were really a big win as part of package 3, but we need the supports and services to go around those housing, and that's what we'll be focusing on for package 4. Package 3 also included a short-term extension of the Money Follows the Person program until November 2020. We are pushing for permanent reauthorization, so another short term is not what we had wanted, but it must be acknowledged that it was a win. The third package also allows Medicaid to cover direct support professionals in the hospital and acute care settings. Before this was not allowed under Medicaid, and this will allow for continuity of services if an individual with disabilities is hospitalized due to COVID-19 or any other reason. This was a permanent authorization and not just for the current pandemic. What was missing? Unfortunately, there was a lot missing. What was missing was adequate Medicaid funding to ensure states can provide care to everyone who needs it, including those who are not currently accessing services or who are eligible but on waiting lists. It did not include HCBS grants to support direct support professionals and the home health workforce, and to support individuals with disabilities in their homes and communities. It did not include any language acknowledging the need of direct support professionals for personal protective equipment or PPE or other medical supplies. This puts the irreplaceable workforce at extreme risk. It did not include, as I mentioned, the permanent reauthorization of the Money Follows the Person program. And this is particularly concerning as we are at a point where we have a real concern around the high risk of reinstitutionalization for people with disabilities. We have an instance in Texas where in an institution there that houses over 400 individuals, there are already over 50 cases of COVID-19. This is one example of why it's so important to have access to community-based services so that individuals can be safe in their homes and in their community. And as mentioned earlier, there's no way for people on SSI to easily get their rebates. This is an easy fix that we'll be working with the Social Security Administration and legislators to work to fix in the next package. There's no boost to Social Security or SSI and no new SNAP funding. There was a $15 billion boost to SNAP, but it was not new money, and that's what we will be asking for. So what are our biggest asks for package 4? The biggest ask is funding for a Medicaid grant program to support access to home and community-based services, again, to combat institutionalization and to support the DSP workforce. Specifically, Congress should pass the bill called the Coronavirus Relief for Seniors and People with Disabilities Act. Again, that's the Coronavirus Relief for Seniors and People with Disabilities Act. That has been introduced in the Senate by Senator Casey and others, and in the House by Representative Dingell. And it had the full support of the Family and Aging Task Force in the House. It was also that Coronavirus Relief for Seniors and People with Disabilities Act was included in the package that the House Speaker, Speaker Pelosi, introduced last week. And so we will fight to make sure that that is a key piece of package 4. We will also be working hard to ensure that personal protective equipment, or PPE, is available for direct support professionals and the home care workers. This is urgently needed to protect the health and safety of the critical workforce. Direct support professionals must be designated as essential workforce so that they have access to that PPE and the medical supplies that they need. Another big ask will be paid leave for caregivers. There were some provisions that provided paid leave support for individuals who had family members who were children with disabilities, but as more people with disabilities lose their usual sources of care, their programming closes, family caregivers are scrambling and need access to paid leave and sick days to help their loved ones, even if they're not children. Congress should include all family caregivers in the emergency paid leave provisions, and that's what we'll be fighting to include into package 4. Also, we will be fighting for help for people on supplemental security, or SSI, to access recovery rebates. People with disabilities have been asked to file needless paperwork in order to access those stimulus payments, and Congress should tell federal agencies to use their existing authority to share data and file for people on SSI to make sure that the funds are available to individuals that need it. Those are the main asks. They're not the only ask, but they're really what we're focusing on as a community, because we know that the next package will be moved quickly. We also know that there's been conversations around the fact that package 4 might have a focus on infrastructure, and it will be very important to focus Congress and focus your legislators on the fact that infrastructure also includes the infrastructure of care. The infrastructure of people with disabilities and their caregivers having the supports that they need to keep people in the community. So what can you do? What must you do in order to make sure that people with disabilities, the workforce, and the workforce and all the needs of the community are recognized? Call your members of Congress in their local offices with those asks, and reminding them what we need as a disability community, and reminding them also that they need to lead and that they need to get back to Washington and pass this 4th package. Email with that same message, tweet your members of Congress. The ARC of the United States has action alerts for all those 3 activities: calling, emailing, and tweeting. They're paying close attention right now, the Congress and staffers, social media. So please make sure to take time to share your information in social media. One really simple way to do this is to record a video about why the disability community and why these needs are so important. The ARC has started a campaign, #WeAreEssential, to raise these issues, the need for HCBS, the need for PPE, the need for paid leave for caregivers, and the need for better supports for people on Social Security. And so please make sure to record those videos so that that the force and power of the disability community is seen on social media by legislators and by the broader general public. Please continue to do the work so that we can make sure that our needs are included in package 4. We will continue to update you whenever we possibly can, and thank you for all the work that you're doing.